Did you know that colon cancer is killing more young people than ever? It's a startling fact, but one that we need to face head-on if we're to combat this growing threat. But first, let's understand what colon cancer really is. Colon cancer, also known as colorectal cancer, is a disease that primarily affects the large intestine or rectum. This happens when cells in these organs stop growing or behaving normally. You see, our bodies are made up of trillions of cells, most of which grow and divide in an orderly way to keep our bodies running smoothly. But when the process goes haywire, as it does in cancer, cells can grow out of control, forming a mass called a tumor. Now you might hear the terms colon cancer and rectal cancer used interchangeably, and there's a reason for that. Both the colon and the rectum are part of the digestive system and are made up of the same kind of tissue. There's no distinct border between them. So when we talk about colorectal cancer, we're referring to cancers that affect either or both of these organs. While it's true that colorectal cancer can affect anyone at any age, most cases occur in adults aged 50 and over. But as recent trends have shown, an increasing number of younger adults are also being affected. This includes well-known figures like the late Black Panther actor Chadwick Boseman, who tragically died from the disease at age 43. With colon cancer becoming increasingly prevalent, it's crucial to recognize the first signs and symptoms to ensure early detection. But what are these signs, and how can we stay one step ahead of this disease? Stick with us as we delve deeper into this important topic in the next part of our discussion. Increasingly, colon cancer isn't just a concern for those over 50. A recent report from the American Cancer Society paints a troubling picture. The incidence of colon and rectal cancer is on the rise among younger adults, with a shocking 1 in 5 new cases occurring in individuals under 55 years old. This is a significant increase from the 11% observed in 1995, with the percentage doubling to 20% by 2019. Worryingly, this trend isn't just limited to the number of cases. The data shows a shift towards more advanced stages of cancer among younger patients. While overall colorectal cancer rates have been declining, the opposite is true for those under 50. This isn't just a faceless statistic. Real people, young people, are being affected by this deadly disease. Take, for example, Josh Herding, a healthy and active 34-year-old. He was blindsided by a colon cancer diagnosis after noticing blood in his stool. Despite no family history of the disease, he underwent successful treatment with chemotherapy and surgery. And then there's Nikki Lawson, who at just 35 was diagnosed with stage 3 rectal cancer. She underwent surgeries, radiation therapy, and chemotherapy and is now in remission. It's essential to note that colorectal cancer is the leading cause of cancer death in men under 50, and the second leading cause in women of the same age group, behind breast cancer. This is a stark contrast from the late 90s when colorectal cancer was the 4th leading cause of cancer deaths among both men and women under 50. Understanding the first signs and symptoms of colon cancer is key to early detection and treatment. It's a message that resonates with those like Josh and Nikki, who've lived through this ordeal. It's a wake-up call for all of us to be vigilant and proactive about our health. So, what are the first signs and symptoms of colon cancer, you may wonder? Well, the tricky part is that colorectal cancer may not present any significant signs or symptoms in its early stages. This is why staying informed about your colon health and getting screened regularly is of paramount importance. Imagine a polyp, a small clump of cells that forms on the lining of the colon. According to the American Cancer Society, a polyp can take as long as 10 to 15 years to develop into cancer. That's a long time when symptoms may not be apparent. Therefore, symptoms often only start appearing once a tumor grows large enough to affect the surrounding organs and tissues. So, when symptoms do start to show, what should you be on the lookout for? Well, changes in bowel habits, such as diarrhea, constipation, or narrowing of the stool that lasts for more than a few days, can be a sign. You might also experience a feeling that you need to have a bowel movement that's not relieved by doing so. Rectal bleeding or blood in the stool can also be an early sign of colon cancer. This might appear as bright red blood, or it might cause your stool to look dark. Other symptoms may include persistent abdominal discomfort such as cramps, gas, or pain. Unexplained weight loss, weakness, or fatigue can also be symptoms of colon cancer. Remember, these symptoms can also be due to conditions other than colon cancer like infections, hemorrhoids, or inflammatory bowel disease. But if you're experiencing any of these symptoms, it's important to talk to your doctor so the cause can be found and treated if needed. One thing to remember is that early detection is crucial when it comes to colorectal cancer. The survival rate for early-stage colorectal cancer is around 90%. That's a big percentage, highlighting the importance of staying vigilant about any changes in your body and getting regular screenings. Recognizing these symptoms early can lead to early detection, and early detection can save lives. Now that we know the signs, how can we reduce our risks and catch colon cancer early? When it comes to colon cancer, prevention and early detection are key. One of the most effective ways to catch this disease in its early stages is through regular screenings. The American Cancer Society recommends that individuals begin regular screenings at age 45. These screenings can detect precancerous polyps or abnormal growths in the colon or rectum before they have the chance to turn into cancer. Screenings come in various forms, including colonoscopies, which can both identify and remove polyps during the same procedure. Other types of screenings, like stool tests, can be done at home. It's important to discuss with your healthcare provider which screening method is best for you, considering factors like your age, family history, and overall health. While screenings are crucial, there are also lifestyle choices we can make to reduce our risk of colon cancer. A diet rich in fruits, vegetables, and whole grains, while low in red and processed meats, can help protect against this disease. Regular physical activity is also beneficial. It's recommended that adults get at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity activity each week. Maintaining a healthy weight and limiting alcohol consumption can further decrease your risk. It's also crucial to pay attention to our bodies and not ignore potential symptoms. If you notice any changes like blood in your stool or persistent abdominal discomfort, don't hesitate to reach out to your healthcare provider. Early detection improves the chances of successful treatment. Finally, if you have a family history of colon cancer or certain genetic syndromes, you may be at higher risk and should consider getting screened at an earlier age. Speak with your healthcare provider about your family history to determine the best course of action. Regular screenings are our best defense against colon cancer. So, let's prioritize our health, stay vigilant, and remember that early detection can save lives. With colon cancer affecting more young people than ever, it's time for us to take action. The rise in colon cancer cases amongst young adults is not just a statistic, it's a wake-up call. It's a call to pay attention to our bodies, to listen to the subtle signs it might be sending us, and to take preventive measures seriously. We're living in an age where information is literally at our fingertips. So let's use it to our advantage. Educate yourself about colon cancer. Understand its first signs and symptoms. Knowledge is power, and in this case, it could very well be a lifesaver. Getting regular screenings is crucial. It's not just for people with a family history of the disease or those experiencing symptoms. It's for everyone. The American Cancer Society recommends starting screenings at age 45, but with the recent trends, it might be wise to consult your doctor about starting earlier. Early detection is key. When caught in its early stages, colon cancer has a survival rate of 90%. That's a number we can't ignore. The sooner it's detected, the higher the chances of successful treatment. Let's not forget the importance of a healthy lifestyle. Regular exercise, a balanced diet, reducing alcohol intake, and avoiding tobacco can all lower your risk of developing colon cancer. It's not just about living longer, but living better, healthier lives. We can't control everything, but we can certainly take control of this. We can arm ourselves with knowledge, make informed decisions, and take the necessary steps towards prevention. Remember, your health is worth fighting for. Stay informed, get screened, and take action against colon cancer today. Let's change the narrative and turn the rising trend of colon cancer amongst young adults into a thing of the past. It's time for us to stand up, to advocate for our health, and to make a difference. Because every life is precious and every life is worth fighting for.